Well, welcome everyone to USC's Great American Smokeout 2022 Virtual Quit Resource Fair. Thank you for taking time out of your day today to join us to celebrate the Great American Smokeout for the next 30 minutes here. I'm Julie Chabdi, Assistant Director of the Health and Wellbeing Programs with the USC WorkWell Center. Today, we'll share tobacco cessation resources available to you as a student, faculty, or staff, and hear from all of the partners listed. We'll have a few minutes for Q&A, but feel free at any time during today's webinar to put your questions into the chat or the Q&A function, and our partners on this webinar will answer your questions. We'll also be holding a behind-the-scenes raffle at the very end and contacting the winners directly and privately after today's webinar. So congratulations on taking a big step today to learn more about the cessation resources available to you as well as others. There is no safe way to use tobacco. All types of tobacco products contain chemicals that can be harmful to your health and our environment. E-cigs or vaping devices do not contain tobacco, but they can contain nicotine and give off aerosols that may contain harmful chemicals. In addition, breathing in secondhand smoke can also increase the risk of various cancers and heart disease. People who quit at any age are more likely to live longer and lower your risk of certain cancers. And we know that quitting can be hard. There are many ways to quit, and using more than one way usually works best. So we're here today to share the resources available to you and support you on your quit journey. So thank you for celebrating the Great American Smokeout with us. I will now turn it over to my colleague, Minnie Ho, Executive Director, Marketing and Communications with Student Health, to share more details on the Great American Smokeout.
Thank you so much, Julie. Hello, everyone, and thank you for joining. If you are here, it means you've already taken first steps to meeting some important personal health goals. So whether you're interested in improving your current health or reducing risks to your future self, giving up tobacco or vaping products is consistently shown to be one of the top ways to improve your health outcomes, both immediately when you quit and many years into the future. I am a former smoker myself, and from a family with a pretty long and extensive history of both smoking and cancer. I'm glad to say that I've been tobacco-free for more than 2 decades, and now the next generation in my family is also tobacco-free. So your choices today can make a big difference both to yourself and the many people around you. Don't be discouraged if you quit and then have relapse into smoking. This is common, and tobacco and nicotine products are designed to be addictive. But you can do it, and today's resource programs can help. From all of us here at USC Student Health, Tech Medicine of USC, we congratulate you on taking this first step on your quitting journey. Let's start with our first presenter.
Hello, everybody. My name is David Wu. I'm the Financial Reporting and Project Analyst at the Health Plans Department.
And I'm Nick Mollis, Associate Director on the Health Plans team.
So those who are members of the PPO, EPO Plus, and the Trojan Care EPO plan are able to have 2 tobacco cessation programs per calendar year. These are provided, those who are on the EPO plan our EPO Plus plan is covered by 100%, whereas those on the PPO plan on Tier 1 and Tier 2 are covered at 100%, and those who go to Tier 3 are at 50%. Anybody on the Anthem HMO, Anthem My Choice HMO, or the Kaiser Permanente HMO have their own separate programs. They're all free of charge with the parties. They also provide prescription drugs as well. Next slide.
In addition to the programs that David had mentioned, anybody who is enrolled in any one of our USC Employee Health Plans is eligible for the tobacco cessation program provided by USC Premier Care. So I believe we have Martha and April that will talk to you more about that in the coming slides.
Good morning, everyone. I'm Martha Jones, and I'm the manager of USC Premier Care. We work hand in hand with the USC Health Plan. And thank you so much for your interest today in joining us. April?
Good afternoon, everyone. My name is April Kelly. I'm one of the RN care managers with USC Premier Care.
Next slide. Thank you. We wanted to tell you about our program, and thank you all so much again for your interest. This is a 12-month program available, as the folks from the health plan mentioned, to all USC employees. We launched in 2021 in the fall, and we're pleased to say that we're going to be going into 2023 with this excellent program available, and this will help reduce tobacco-related diseases and improve your quality of life. Services are available for 200 employees, and we're really excited about the success rate. The services are in person in multiple sites, or you can get service through telemedicine visits.
The Tobacco Cessation Program is an example of limitless care coordination that is supported by the USC Health Plan, Keck Pharmacy, and Occupational Therapy. It is comprehensive and tailored to individual needs. Participants have consistently provided feedback that the one-to-one coaching and collaboration were instrumental to their successful quit plan.
We're excited that this program is getting good feedback from patients. We've had good successes with the patients we've worked with to date. We have a graduate this week, we're happy to say, who has quit smoking for over a year now. And we have available through this tailored cessation plan, free nicotine replacement medications. Pharmacy is going to talk about that a little bit. And the first 3 months are the most intensive. And then we tailor the needs of next steps through the year to you, the patient.
As you'll hear more from the pharmacy and occupational therapy teams, participants work with pharmacy on medication options and management. Occupational therapy through lifestyle redesign will help create health habits and routines. And I, as your care manager, will follow you throughout the year to support your goals.
Excellent, April. Thank you so much. And again, thanks to the health plan, to our pharmacy and OT partners on this excellent program. And please, at the bottom on the right, we are available at 833-SC-NURSE. Call us today, call us anytime, and we're happy to start you through the path for the next many months to get you nicotine free. And we're going to turn it over to pharmacy now. Thanks.
Hi, good afternoon. My name is Carrie Trotter-Wall. I am the director of the pharmacies located here on the University Park campus. My colleague, my clinical coordinator, Katie Sue, is unavailable today, but she is the main contact for this program that we offer here. The smoking cessation program has been a resource at the USC pharmacies for well over 15 years. We've been helping faculty, staff, and students such as yourself quit smoking and vaping for some time to come. Most recently, we've collaborated with the USC Keck Premier Care and other departments in this effort. My clinical team is comprised of highly trained clinical pharmacists as well as clinical pharmacy residents who are also licensed pharmacists, and they help run our tobacco cessation program at multiple locations. The locations that we offer under the USC School of Pharmacy, we have 5 different pharmacies, but 3 of our pharmacies are the locations that we actually have patient care services. So the first one is located on the University Park campus. This is the USC Health Center Pharmacy. This is located adjacent to the Engelman Student Health Center in the Jefferson parking structure. I know it sounds awkward, but we do have a pharmacy located in a parking structure. Our second location is on the HSC campus. This is located at the USC Medical Plaza Pharmacy. This pharmacy is adjacent to the Keck Hospital. So that address, as you can see on the screen, is on San Pablo in HCC 1. Our third location that offers clinical services is at the USC Verdugo Hills Professional Pharmacy. This pharmacy is located adjacent to the Verdugo Hills Hospital. Next slide.
Hi, everyone. My name is Whitney. I'm one of the pharmacy residents here at USC, and I just wanted to go over a few things that we do during our consultations for our tobacco cessation programs. So in addition to the tobacco cessation program that we offer to students, we also offer them to USC employees through our USC Premier Care service. Initially, when you come in for your consultation, we'll discuss things like history and also your goals in tobacco cessation and where you want to be in terms of nicotine independence. Then we'll determine a quit date, and we'll also talk about different things such as nicotine therapy, in addition to lifestyle and behavioral modifications. Typically, we will initiate your medication. We'll also adjust based on your progress, and then just keep in mind that we also collaborate with patient care teams. So your primary care doctor, psychiatric care, and also occupational therapy, we also collaborate with everyone at USC. In addition, we do have telehealth options that are available, and you also have free follow-ups and unlimited consultations with us. And of course, our information is listed on the slide. So if you have any questions, feel free to email us.
Hi, everyone. My name is Emma Shiwi. I am an assistant professor of clinical occupational therapy, and I'm located at the USC's Occupational Therapy faculty practice. At the faculty practice, we do a type of lifestyle redesign, which is an intervention method used through occupational therapy, where we assist people in making lifestyle modifications to support themselves through changes and different health and wellness goals, such as smoking cessation. As I was saying, lifestyle redesign is a type of occupational therapy where we work one-on-one with our clients to support them in creating holistic plans of care that go over different behavior modifications, habit formations, and just in general, looking at different daily routines, supports and barriers to creating these health changes, and also creating just an overall healthier lifestyle. This service line is both in person at the HRA building on the HSC campus, but also in person at the UPC campus, where we are located in Herman Student Health Center. Although we are both located on both campuses, we also do teletherapy services that are covered through most insurances currently. We serve all members of the USC community, not just our faculty and staff, but also our students. And we complete free insurance benefits checks prior to seeing our patients in order to ensure that they are able to access our care. And if they're needing any financial support, we can have those discussions as they come up. I've included the contact information for us on the slides, just in case you are curious about setting up these services. Some of the different things that we can help with when coming to smoking cessation is going over different behavioral factors and lifestyle modifications that may be impacting your quit attempts. So understanding how tobacco dependence can create different health problems, and also preventing overall health concerns in the future, analyzing different triggers and how to help us with cravings as we're quitting smoking, implementing different medication health management routines and nicotine replacement therapy that may have been prescribed through pharmacy or your doctor, learning about mindfulness and different coping strategies to help with any cravings and triggers that may come up, creating different health promoting lifestyle routines such as eating routines, sleep routines, and physical activity that can support overall health and wellness during smoking cessation. And also learning how to manage different chronic conditions that may come with smoking, such as learning how to navigate an increase in appetite, differences in lung function, as they may impact other daily routines.
Hi, everyone. My name is Shu Lee, and I'm the program administrator for the USC Norris Comprehensive Cancer Center AYA program, which stands for Adolescent and Young Adult Cancer Program. Here we're serving young adults with cancer who are between the ages of 18 and 39 with holistic care, support groups, resources and tools, as well as fun social events and also retreats to help them form a community that can support these young adults and their families through their cancer journey. So we're very, very passionate about the Great Smokeout event because we know that smoking can not only lead to lung cancer, but also causes cancer almost everywhere in the body. And e-cigarettes, although the long-term effect is still under studies, but we know already the fact that they irritate the lungs and also have negative effects on the hearts. And hospitals have been seeing a rising trend of patients with lung collapse who do not smoke but vape, especially among young people. So that's a very big concern for us as we serve our patient population. And we know that quit smoking and vaping can be very challenging, and you don't have to feel alone. That's what we have learned from serving our young adults population, that there are actually a village behind this with all the resources like the partners have been already sharing. And there are a lot of supports from their families and friends, and also a lot of organizations like American Cancer Society, who has been providing a lot of partnership with the community, providing resources and tools for help people quit. Their most recent initiative is called Empower to Quit, which you can see from the flyer here. And the American Cancer Society team can send you daily emails to remind you, to give you continuous support once you sign up the quitting process. You can easily scan the QR code or go to their website to sign up. The sooner you quit smoking or vaping, the more you can reduce your chance of getting cancer or other diseases. And again, it just takes a whole village to help support you going through this process. And thank you for taking your first step today and reach out for support.
Hi, my name is Diane Melrose. I'm a dental hygienist and full-time faculty member at the Herman Ostrow School of Dentistry. And I'm very, very happy to be here today. We'll do the next slide. And to share some information about the effects of tobacco on oral health. Smoking and use of any kind of tobacco products is the highest risk factor for oral and throat cancer. It also is a risk factor for gum disease and cavities. As you can see from this slide, this year, California has the most estimated new cases and deaths of oral and throat cancer in any state of the union. Early detection is so important. So I'd like to advise you all to make sure that you're getting an oral cancer exam when you visit your dentist or your dental hygienist. Even if you don't use tobacco, please get these oral cancer screenings. I also would like to recommend that you do a self-exam every few months. Use a flashlight and go in very carefully, look at the sides of your tongue, as you can see in the slides here. Look at underneath your tongue, the floor of your mouth, look at the roof of your mouth, and the tonsils in the back of your throat. If you see any white patches or red lesions or feel a lump or a bump, it's real important that you see your dentist and get a really thorough exam. So I've listed here of the great resource, the American Cancer Society, which you just talked about, gives you more information on oral and throat cancer and ways to quit. And I've also given you information on how to become a patient at the dental school or our faculty practice. So thank you for being here. It's really, really important to stay healthy, stop using tobacco, and really take care of yourselves. Do those oral screenings when you can. Fight on.
Great, and thank you so much to all the partners who have shared so far. I just want to share some of the services available through the WorkWell Center for faculty and staff. We provide work-life wellness services for faculty and staff, and they're cost-free, confidential, and convenient. So we have health and well-being programs. We offer counseling, and this is a great opportunity for those of you that might want to meet with a clinician either on site or through Zoom to talk about any concerns you might be having that might be triggering your desire to smoke or vape. In addition, we have coaching, we do consultations with departments, and we also provide talks on health and well-being related topics to various schools and units throughout campus. So feel free to visit our website, workwell.usc.edu, for more information.
All right, well, good afternoon, everyone. My name is Alan Sahasanen, and I'm with the Environmental Health Safety Office here at USC. I'm located at the Cal building on the UPC campus, and we also have a partnering office over at HSC as well. I'm here basically to share that our campus does have a smoke-free policy, and this policy does apply to all USC schools, departments, and all members of our campus community, okay? The policy also applies to all facilities, including housing, our hotel, athletic and performance facilities, and other areas where research and clinical work is done. We also want to share that this policy includes the use of cigarettes, e-cigs, pipes, and other lit products like vaping materials as well, and includes substances, but not limited to both tobacco, clothes, marijuana, and so forth. So again, the link to the policy has been provided, and if you have any questions, please feel free to reach out to us. Thank you.
Well, a huge thank you to all of our partners today. As you heard, there are so many different resources available to our USC community to help support you to live a smoke, tobacco, and vape-free life, and to have access to the benefits and resources to improve your health and well-being. So thank you all for your expertise, your commitment to tobacco prevention, education, and control, and to ensure that our USC community has the support it needs. And congratulations to those who have taken the step today to learn more about the resources available. We're here to support you, and we hope that you'll spread the word to other faculty, staff, and students who might be interested in these services. With that, we'll be holding a raffle based on the attendees today and contacting you offline if you are a winner. So I want to thank the partners who have generously donated a $50 gift card to the USC bookstore from Student Health, a $50 Amazon gift card and sweatshirts from the Norris AYA program, and a WorkWell Center mug and lunch bag. So thank you so much. And now we have about 7 minutes left for Q&A. So I will just end the slideshow, stop sharing, and see if anyone has any questions. Feel free to put it into the chat or to the Q&A, or raise your hand. We'll give it a few more minutes. I know we had one question in the Q&A that was answered already about the student health plans. I don't know if anyone wants to expand on that. Yeah, I see a question about e-cigs. I don't know if anyone wants to attempt an answer for that about using e-cigs as a way to quit.
Yeah, I can add in on that. So the thing about e-cigarettes is that the FDA has not approved any type of specific e-cigarette for quitting. So when it comes to e-cigarettes, it's not really in the literature or recommendations that they are used for quitting. So in terms of that, we typically try to use nicotine replacement products for quitting. E-cigarettes are not that useful and they're not effective.
Thank you for that, Whitney. Any other questions or any other comments that maybe the partners want to share before we wrap up?
I can at least share something about the student health question. I'm not sure if you have Aetna Student Health, but I know for our services in particular with occupational therapy, the sessions cost $15 per session with Aetna Student Health across the line. If you do have a different insurance plan, as I said before, we can do an insurance benefits check prior to your evaluation. But those services are supposed to be made very accessible for our students. And we also have a financial hardship program if the $15 copay is too much too.
Wonderful. Thank you for that financial information, Emma. Great. Well, if there are no other questions or comments from the partners, we want to say thank you for joining us today. And we hope that you have a great rest of the day and good luck on your quit journey. We're here to help. Thank you.